once again, thank you so much for sending that. Hello everyone, this is Vishakha and we are back again with yet another session. And today we have a great speaker, Dr. Shylah Schauer. She is a naturopathic doctor specialized in the gut-brain microbiome axis, and it is itself very interesting. She assists clients using an evidence-informed natural treatment, options to digestive complaints, hormone imbalance, mental health, and sleep. She is practicing online, providing telehealth consultations anywhere in the world. Treatments include personalized health plans using supplementation, diet and lifestyle, counseling, and functional labs. She is a 200 registered yoga teacher, trained in Hatha yoga style yoga, and has been practicing yoga for the past 16 years. She is teaching vinyasa, power yoga, yin, and Hatha yoga. And she also offers a virtual free health yoga every Sunday. So we welcome you on the behalf of OYG. So welcome and over to you.
Thank you so much for having me. Thank you so much for giving me the opportunity to talk about the gut microbiome and its effects on mental health. So like you'd mentioned, my name is Dr. Shylah Schauer. I'm a naturopathic doctor here in the US and also see patients, clients from all over the world. My specialty is digestive health, and I've been really learning everything I can about the gut microbiome for a long time now. So when given the opportunity to pick my topic, I always talk about the gut microbiome and its effects on mental health. So I'm going to talk a little bit about just the basics of the microbiome and then the gut-brain axis and how we sort of define that, and talk a little bit from the perspective of mental health, and then kind of talk a little bit clinically. So hopefully this PowerPoint works. So starting off with the gut microbiome, I know a lot of us have heard about the microbiome and what that means. We can find the microbiome everywhere in the body. So from the skin, the intestines, the stomach, the nose, everywhere you're going to find microbes. But so when we're defining what the gut microbiome is specifically, we're talking about the totality of microorganisms that can include bacteria, viruses, protea, and fungi, even some one-celled organisms and plants, and all their collective genetic material, and specifically in the gastrointestinal tract. So we kind of have two realms with the microbiome. We have an older model and a newer model. So the microbiome was originally talked about from the perspective of environmental or microbiology. And now we're sort of evolving into talking to the symbiotic relationship of the microbiome and how it plays out in our bodies. So even when thinking about infectious disease, our first line of defense is going to be our microbiome itself. So it's important to make sure we have a diverse organisms that are living on our body. For every one human cell we have the equivalent of 10 microbe cells. So you're more microbe than you are human, which I think is a very fun fact. And you know, you're kind of here to be a good host to your bacteria. So talking a little bit about the benefits of the gut microbiome specifically, here's a sort of chart that you can see certain bacteria types and where they'd be found specifically in the stomach, intestines, small and large intestines. They play a huge role in a bunch of different processes within the body. They maintain the metabolism and help you break down and process and even make for you nutrition, help with metabolism. They regulate a lot of physiological responses within the body, whether it be endocrine system, they can tell the bowels when to move. They have a huge role in the immune function and also in mental health. So those are just some of the basic things that we think about when we think about the benefits of the microbiome. And then kind of talking a little bit about the microbiome from the perspective of the pathways that we talk about, how they're playing a whole role on our overall health. Because, you know, I've yet to find anything that I wouldn't treat the microbiome as well. So this is a new emerging field called Neuroendocrine Immunology. And it's three pathways that are biodirectional, meaning that they talk, they're not just going from the gut up to the brain or vice versa. They're signaling to each other and kind of telling the overall system what's going on. So breaking it up into the sort of three parts, we have the endocrine pathway, the neuroendocrine pathway. We have the vagus nerve pathway, and then that is really related to the enteric nervous system, specifically in the gut. And then we also have those immune regulating pathways. So like I mentioned, these three pathways are kind of, the neuroendocrine immunology is how we start to sort of explain how the microbiome is interacting with every part of our body. So starting with just talking about the endocrine side of things, there's 20 different types of endocrine cells in the intestines, and making the intestines themselves the largest endocrine system of the body. This is also related to the hypothalamic pituitary adrenal axis. So we're having all this sort of hormone regulation that's happening in the gut, regulated by the microbiome itself. Talking about the vagus nerve pathway, and we talk about this a lot, I think, you know, in the yoga, when we talk about the sympathetic versus the parasympathetic system. So this is an autonomic, meaning it's controlled automatically without our input. And it's just a way of talking about the enteric system, that rest and digest system that's happening in the gut. And so how the microbes are signaling to our nervous system what's going on, and vice versa. So if you're having moments of stress or a lot of fear, through the nervous system, we can signal to the bacteria, and we can see just from stress alone a huge die-off of bacteria. So all of this signaling is happening bidirectionally. Also talking about the immune regulators, which I think is such an important topic. It's going to be interfacing with any sort of pathogen. The microbiome is going to be interfacing with any sort of pathogen that the gut could be seeing. So they found, with doing some research on T cells, that if you take mice with no microbiome and introduce a pathogen, nothing will happen to the pathogen. It can kind of take up shop and do what pathogens do, which is be destructive. And then compared to a diverse microbiome, when you introduce a pathogen, the healthy microbiome signals to the immune cells, hey, we have a problem here. We need you to come in and take care of this. So it's almost the normal flora that's regulating if pathogens can set up shop or of immune response, and all of that, the sort of different immune modulators that they can be sending back and forth that can either be causing systemic inflammation or reducing inflammation. So we're finding just a lot of really interesting things with that field. Another thing too, when you think about animals who will wound themselves, right, who will get a cut on their hand or on their paw, you'll see them licking it to heal it. A part of that licking is to get the pathogens to the gut, so then the gut knows what to do to respond and what immune cells to make. So it's very, very important what's happening in the gut and the microbiome. So again, these are the sort of three pathways that we think about when we think about the overarching, is the microbiome affecting our overall health? So going here a little bit to some of the factors that affect the gut microbiome. The gut microbiome is established at birth. So even how you come into this world, if you're a vaginal birth versus a C-section, that'll affect your microbiome. And they've done a lot of research on babies from both. So it's really important to make sure that you're getting a diverse microbiome from birth, starting off at birth, whether or not you're being breastfed or bottle fed will make a huge difference. You're getting a lot of good diverse microflora from the mother's breast milk and from the breast. Like I mentioned before, stress is going to play a role on your microbiome, what you're eating, what that affects what your bacteria is eating, what can sort of flourish and grow. So even looking at it from a naturopathic perspective, if we're seeing someone who's craving a lot of something, like they're craving a lot of sugar, they're craving a lot of meats, they're craving a lot of dairy, that could actually tell us what's going on in their microbiome too, because those bacteria are signaling back to the brain what they want to digest. Pharmaceuticals play an important role, a multitude of pharmaceuticals, not just antibiotics, but we think about antibiotics and their effects on the microbiome, where you're physically at in the world and the temperature, and then just to the lifestyle stages and where you're at aging. So that's all the factors, some of the factors, it's many more that will start affecting what's going on in your microbiome. And then thinking about a little bit about dysbiosis, which is that dysregulation of healthy flora to unhealthy flora, and how that's going to play out on a multitude of different things, whether it's disease itself, certain pathology, autoimmune disease, or inflammation, how you respond to infections, everything with your diet. And so all of those are going to go into kind of the making of problems in the body. So switching over a little bit to specifically talking more about the mental health perspectives of the gut microbiome. So I put up here some of the 4 top things that you'll think about in the mental health comparison of when you're treating somebody who's having maybe depression or anxiety. And these are the top 4 sort of neurotransmitters that we think about, whether it be serotonin, GABA, dopamine, and norepinephrine. And these are all going to be made in the gut. So 90% of serotonin is made in the intestinal tract. And it's made along with nutrients that we give the body. And then it's able to create from those building blocks serotonin. So along with that, this is sort of the framework of what I'm kind of thinking when I see someone who's having maybe a low mood or having anxiety, kind of going first with what one of these neurotransmitters am I thinking is not properly functioning. So starting a little bit with dopamine. Dopamine has a lot of roles in the body. If it's too low, that's when we're going to see things like depression. You can also see things like schizophrenia and mania when dopamine is too high. It's also used a lot in treatments of Alzheimer's because we're finding there's these relationships with the gut microbiome and these neurotransmitters and how that plays out in other pathologies, not just specifically mental health, but Alzheimer's and Parkinson's. Serotonin, like I mentioned, when it's low is going to cause anxiety and depression. But when elevated, we think about that sort of happiness response. And you'll see this with a lot of common medications for depression will treat this sort of serotonin picture. And then lastly, the GABA. So the GABA, again, when you see it low, you're going to have depression or mania or anxiety. And these are all playing out in the interface of the microbiome. And when you start looking at what's happening in the body from this sort of perspective, you can start then thinking bigger about what you're going to be wanting to treat, and what bacteria you kind of want to nourish, to grow, to stay, and others that are maybe causing a problem. There's a lot of really good specific research on this, but even the microbiome itself, we're finding has a sort of circadian rhythm. So it has a sleep and rest cycle that we would have. And so if you're not getting adequate sleep, this could also be playing a role on your microbiome's ability to create some of these building blocks and neurotransmitters for our body to use. And so lastly, I was going to talk a little bit about my clinical experience with taking all that we know about the microbiome and how that sort of plays out when we're seeing patients in real life. And with looking at the mental health, I did a lot of treatment with using certain herbs and probiotics, certain bacterias that I knew would help build some of these neurotransmitters. So when you're looking at the diet and you're looking at sort of the precursors that we need to make these neurotransmitters, how can we introduce that in the diet, where that comes from? And then also how we can make sure that we have the right bacteria there to help the body make these transmitters. There was research that came out, I think it was in 2017, that sort of changed the frontier of how we were looking at the microbiome's effects on mental health, because we were really focusing on these neurotransmitters and how they're affecting our overall mood. But there was research that came out that was done in Africa on patients who were dying with AIDS and HIV. So they wanted to see what other pathologies these people were passing away from. So in their control group, they took the cerebrospinal fluid of people who had also passed away. And the assumption up until science till then was that in the cerebral spinal fluid, it's sterile and you shouldn't have any sort of microbes in there. So in this research in their control group, they were able to find that actually the cerebral spinal fluid is not sterile, and we're seeing microbes in that. So that was this huge shift that happened not that long ago in the perspective of what we're thinking about our relationship to our microbiome and our overall health, especially mental health. So from that research, they found that there's specific immunocells called macrophages that will pick up certain microbes in the gut and cytotaxi it, taking it straight to the brain to tell the brain, this is what we have, this is what pathogen we have and we're seeing in the gut, and then that signaling back down. So it took this huge change in the way that we were looking at like who's running the show, because we had this idea before that we were kind of in control and we were telling the microbes what to do. But now it started introducing, are the microbes the ones telling us what to do and giving us the sort of feedback on the world around us? So that was super fascinating research. And I think we're going to see a lot of things coming up in the next few years around the microbiomes and all of its effects on the body. And I'm really excited for it because we have this symbiotic relationship and we're just learning so much about the microbiome that we had no idea before. And it was kind of, taking a second back. And even right now, we're kind of refining, going from a probiotic to getting very specific with what bacterium we want to add to the intestines to help create, if it's the neurotransmitters, to help give us those neurotransmitters we're looking, and kind of taking a step back instead of then just pushing a pathway through a medication. So I think it's going to be very exciting. And it's already been so exciting to watch just how we've been talking about the microbiome in the past 10 years to now. So that is sort of my presentation part of it. I can answer any questions that people have.
Yeah, thank you so much. This was really a very great session. And basically, these chronic disorders like Alzheimer, Parkinson, if it can be treated just by gut microbiome, this is a very great thing and interesting too.
Yeah.
So first of all, I just wanted to know that how you got to know about this field and what made you to continue and explore so much in depth.
Yeah, so that's a great question. Thank you for asking that. I got into naturopathy through my own sort of health issues. I always had an emphasis where I wanted to study medicine, but I always thought I wanted to do it from the perspective of health policy in the US. And then I was working a stressful job and got sick and was prescribed all of these medications, and kind of had this moment where I was like, this doesn't feel right to me. And so I changed my health. I ate differently. I started doing yoga every day, meditation. And I was able to reverse all of my diagnosis through just doing that work. And I saw how powerful diet and lifestyle and plant medicines could be. And then with the microbiome, just knowing how important digestion is, and a lot of, even I think the plants that when we give people certain plants, that's also playing a role on our microbiome. So I think, yeah, and just seeing, so that was sort of my health journey, kind of propelled me and pushed me to do all this deeper research and seeing how powerful these medicines were. And then taking that information and learning more, and then seeing, especially in the mental health world, just seeing how successful people were by taking a certain probiotic or herb to help with their depression, compared to when I was training, we did a lot of prescriptions. So I would see my patients who would be on prescription medications for these things. And then the patients who would do diet, lifestyle, support the gut health for their sort of mental health issues, and just the huge difference that you would see. And so it was so exciting to see it clinically also play out. And I think that's just what's propelled me even further, is I know that these medicines work, and they're very gentle and harmonizing for the body. And yeah, so that's kind of how I got into naturopathy. Is my
That's
own
really
sort of
nice. Yeah. And recently I was going through an article in which it states that microbiome weighs more than the weight of the brain, and it's around zero point 0.4 or zero point 0.6 kg more than. And you also said in the starting that we are more of a microbiome than the body, and it's really amazing to know.
Yeah.
Yeah. So, is there any side effect of microbiomes if we insert it or infuse it externally?
Yeah. So I think it's important to know what you're trying to accomplish. I think there's also a lot of benefit in using food as medicine, like probiotics that you're making culturally, whether it be sauerkraut, kimchi, kombucha, kvass. Those are really good ways of getting in microbes that are kind of in your environment already. So you're already exposed to them. And we can be very tailored with what specific probiotic we're giving to the patient. But I think you have to have that kind of overall take a step back and look at, what am I trying to accomplish? Am I trying to, you know, create more of this? Am I trying to diversify the entire microbiome? And so we can be really refined in it, but I also think just by taking things like naturally, like kefir or yogurt, is fantastic, or even doing them topically. I had a few patients that we would do, they would have severe skin rashes, some dermatitis or eczema, where taking a non-sugar yogurt topically to just help give that microbiome barrier again, as a defense, was so helpful in allowing them to heal while they're healing other things in their body. And I think more recently too, that I've gotten so passionate about the microbiome is we've created a sort of fear around germs.
Yeah.
And I think if people knew that, you know, for every human cell, they have 10 microbe cells, that they're essentially microbes, then we can start to talk about harmonizing the system instead of trying to kill pathogens. And there's a lot of, and I didn't know this until medical school, a lot of these normal, like streptococcus and staph, are a part of your normal flora. You expect to see them. So if someone comes in and they're having sore throat symptoms, you don't test for strep unless they have other symptoms going on, because strep is, of course, part of your normal flora. So we expect to see it in some regards. And then, you know, from the naturopathic perspective of my brain, my thought is, well, why and what's happening in your gut microbiome that this particular bacteria can overgrow, right? So we're not surprised it's there, but why is it overgrowing? What other bacteria do we need to bring in to harmonize? And we call this an opportunistic pathogen, which I think is a super important thing that people know about, is that a lot of these things that we consider pathogens are only dangerous to us because we're lacking healthy, normal bacteria to allow for it not to overpopulate. And so that's sort of like the naturopathic side of my brain, isn't like, okay, we have to kill these microbes, which I just don't like that terminology. I like to think about, why are they there and what are we missing that can kind of like get rid of them. So the analogy that I like is, if you are at a supermarket and there's these people hanging out that they're kind of like a tough crowd, and it's scaring away all of the customers, and you start playing classical music outside. So you play this classical music, and then these people are like, I don't like this music, let's leave. So you kind of, and so then they leave, and your people that you want to come in your store can come in. So how can we sort of create the most beautiful environment for these bacteria to want to live and to want to stay and flourish, so we can help keep our bodies healthy?
Yes. You spoke about the hormone and microbiome, right? So can we use as a substitute for hormone therapies?
So I think I would say that it's something that is worth looking into. I don't know if it could have a direct, but, you know, even with taking things like a synthetic estrogen, like in a birth control, that we know affects the microbiome. It affects certain nutrients, how we are absorbing them. So most people who are taking that synthetic estrogen are going to have B deficiencies, zinc, selenium, vitamin D. So we know that all of these things are playing together. So if we're seeing a hormone problem, it's not just a hormone problem, right? That's the sort of like holistic, naturopathic sort of view, is that you're not just going to say, oh yeah, let's just take this hormone, from a holistic perspective. And so I guess I would venture to say if you would take a look at the microbiome and the gut health, that you could also be seeing issues with that. And a problem that it's a problem, but it kind of makes medicine simpler now, is that everyone in the Western world has some sort of dysbiosis, right? We take antibiotics all the time. We have a lot of stress. Our food's sprayed in pesticides. There's chloride in our water. So we have all these like compounding factors that are taking a toll on our digestive tract. And we're also not eating the fermented foods that we used to eat back in the day, where we would ferment cabbage or yogurt or whatever. So we're not eating those foods as well. So with that, the microbiome is that sort of protective layer of those epithelium cells in the gut. And so when those sort of go away, they can sort of break apart and then let things in and out of the bloodstream that we don't necessarily want there. And so this is a permeability issue that has been titled leaky gut. So if people are talking about leaky gut, this is sort of what they're talking about. And so when that inflammation happens, you're going to see chronic issues like joint pain, skin issues, hormone issues, everything. So I have yet to find a pathology that I wouldn't also treat what's happening in the gut, because it's such an important part of your overall health. And also, like I said, where we go in the future with this sort of ideology of germs are bad needs to change, because people are so, and that's the thing too, the autoimmunity is on the rise, and the linkage they think is because people are too clean. So we're not giving our bodies things to do, our immune system jobs to do. So then it starts attacking itself. So I think that in order to go forward, we have to start talking about the harmoniousness of the microbiome and start talking about germs from the perspective of they're the majority of you. So I think you'll see a lot in the future of just how we're thinking about everything, including hormones, from how it's affecting. And those three pathways, like I said, the neuroendocrine immunology is just a new field where we're able to talk about the biodirectionalness of all of these things. And we can no longer say, well, this is a hormone issue. This is a metabolic issue. This is an oncology issue, because everything is going on in the body, and you're not just having these singular pathologies and nothing else is going on.
Yeah. So just now it came into my mind, whether it affects our cardiac health as well, or we need some more research on it.
Can you repeat that? Sorry, I didn't.
These gut health microbiomes, these affect our cardiac health as well, or we need some more research on it? Cardiac health, yeah.
Cardiac health? Yeah. No, it definitely is playing a huge role in the cardiac health, especially, like I was saying with the mentioning of the permeability of the gut and leaky gut, because if we're getting all of these things in the bloodstream that we don't want, and they're causing inflammation on the artery system, it's going to take a whole toll. That's our cardiac system, right? So it's affecting everything. And yeah, there's been yet to be one pathology that I can't think of that you couldn't, and everyone's different, right? Everyone has these sort of different archetypal ways that they handle and process the world. The doshas, right, is one way of sort of looking at the three different types. And so the way that people respond to a dysbiosis or stress or any of that is going to look different for every person. And so, you might be a person that gets stressed out and then develops some sort of skin condition, or someone who gets stressed out and then gets stomach complaints, right? It's still how you're responding to the stress. It's just taking different forms. I think that's the beautiful thing about holistic and naturopathic medicine, is that we're not looking at the what, we're kind of looking at why are you having this. And so again, just the resiliency of your microbiome to be able to tolerate stressors and toxins and digestive changes and time changes will really set up who is able to respond to these things, because everyone's having them, right? Everyone has stress. Everyone eats poorly sometimes. Everyone, has all of these sort of life factors. And if we're consistently nourishing that microbiome, it should be able to weather the storms and kind of give us that protection in moments that we're needing them. And I think that's going to be like my perspective, one of the biggest factors of overall health is, how is your gut microbiome? Is it diverse, or is there dysbiosis?
Yes, this is perfect. So, do you like to give any advice or any takeaway message for our aspiring doctors who are listening to you?
Yeah, keep learning and keep, find what you're passionate about and go forth and share it with the world, because these things are so powerful, and they can impact people's health in such a fantastic way that this particular medicine is so potent and it's just so powerful. And the more that you can learn and the best expert you can be in whatever you're passionate about, you bring so much benefit to yourself and your community. So keep it up, and it's wonderful medicine.
Thank you. Thank you so much for this wonderful session. And we'll be looking forward to meet you again and utilize your knowledge. This is really amazing.
Yeah, thank you so much for having me and letting me talk about the microbiome.
Yeah. Thank you.
Thank you.